Thank you very much, Joyce and Skip. I appreciate the kind introduction. First, I must say a thank you to the National Health Services Corps, which has provided the financial support to make and put professionals into underserved areas such as Mobile. Joyce and Skip, please feel free to stop me at any time with any questions, as I'm used to the medical students stopping me at all times. Thank you. As mentioned above, our topic is psychotic disorders. So we're going to talk about some specific goals. And the first goal that I have is that everyone that has psychotic symptoms does not necessarily have a psychotic illness. Also, I'd like to expand on that psychotic disorders are like any other medical illness in terms of their causes, their treatment, and impact. And finally, give you some information of where you can find out more. When we talk about psychosis, I think the first thing to realize is psychosis is a symptom. It is not a specific disease. It can be associated with many different disorders, both medical as well as psychiatric. And if we were to give a definition to what is psychosis, we would say that it is a gross impairment in reality testing, often in the face of contradictory evidence. And when we speak about psychotic illnesses, they're generally chronic, severe, disabling brain diseases that impact all areas of functioning. When we speak of psychotic illnesses such as schizophrenia, there are many different symptom categories. There are positive symptoms, things that normally aren't there that are now present. An example is something that people are very familiar with is hallucinations. Hallucinations are a time when somebody has different sensories being stimulated in the absence of actually anything doing that. They also can experience delusions, which are false fixed beliefs. These are things, when we consider positive symptoms, that normally aren't present in the everyday person. However, then we also have negative symptoms, things that normally should be there that are not there. And that may be their affect, so they may have very little emotion on their face. It may be that they have a poverty of speech, or it may be that they have very little interest in activities. You'll see that a lot of these negative symptoms are similar to what you would see in something as depression. And in doing so, it can also be mistaken early on for depression. The final spectrum, an area that may be affected by these psychotic illnesses, are cognitive impairments. So the person may have difficulty focusing in becoming attentive. They may have memory impairments, as well as may have impaired what we call language or executive functioning, where they have to do complex tasks. Now, Skip, I know you had a question early on that you were prompting me with. Go ahead, ask me your question.
One of the questions we have is that how can you tell the difference between when someone's on drugs and when someone has a mental illness?
Yes, so this is a very good question. Thank you, Skip. I have to say that it's very difficult acutely or at the one snapshot in time to tell the difference between when somebody's on drugs or when somebody is dealing with mental illness. Generally, observation of the person when they're off of the drugs, as well as giving it some time. If they clear very quickly from their psychotic symptoms in the absence or when they're off of drugs, then often we can tell that there's probably not a psychotic illness. However, if they continue to have psychotic symptoms while they're off the drugs, it's much more likely that they're going to have a psychotic illness. I'm going to talk briefly about making the diagnosis of a psychotic illness. And the first thing that I think you should realize is that physicians generally make this diagnosis after an extensive workup. And the first thing that they generally do is they interview the patient and their family members. They go through a physical and neurological examination. And then they do a series of tests. And a lot of them involve blood tests to find out if there's certain deficiencies in the body or certain pathways that the body should be, like the liver should be functioning or the kidneys should be functioning. And if those aren't functioning, they may build up toxins, which then give them psychotic symptoms. The final thing that they often do when somebody starts expressing psychotic symptoms is image the person. So take a brain image, what we call a head CT or an MRI, things that are used kind of like an X-ray, but of the brain. And generally, when we start going into the different psychotic illnesses, either professional counselors or psychiatrists can be very helpful in making the specific diagnosis. If we were talking in generalization, I would say that when you're working up somebody and you're concerned if somebody may have a psychotic illness, the first thing that the physician or counselor may do is rule out what general medical illnesses could be contributing to this. the next thing is they rule out any substances, and after they exclude those two, then they start speaking about specific conditions. And when I talk about things that can cause symptoms to look like psychosis or that present with psychosis but aren't actual psychotic illnesses, I'm talking about sometimes medical conditions. Recently, I had a family member brought in that had been in a horrible motor vehicle accident and had surgery. When they were in the ICU, they felt that some of the staff was trying to kill them, trying to poison them, trying to hurt them. But actually, this was just a result of the body having such a stressful medical condition that it started manifesting psychotic symptoms. You may also see psychotic symptoms in somebody that has something like delirium or dementia, someone that's older and their brain starts to have trouble and they may have some worries and concerns. Also, substances. They can be either while they're acutely taking the substances or when they're coming off the substances. Now, if we talk about specific psychotic disorders, probably the most classic disorder is schizophrenia. And there's certain things that go into the diagnosis of schizophrenia. The first thing that you should realize is that the person has at least 2 psychotic symptoms. So we talked about positive, negative, and thought disorders. And those type of cognitive symptoms, if you have at least 2 of those symptoms for at least 1 month, but that there's signs and symptoms of this disorder dating at least 6 months, that will help you make the diagnosis of schizophrenia. Generally, schizophrenia impairs all areas of functioning, and there's no known one thing that makes it come about or one etiology. Within the psychotic disorders, if we back up a little bit, there's 2 big groups. There's mood disorders, and then there's primary psychotic disorders. So for instance, somebody may become severely depressed and then start expressing some hallucinations, delusions, some psychotic symptoms. And it's actually that they have a severe mood condition, such as major depression, or it could be something like bipolar. And just when those times when they get very stressed or overwhelmed and their mood disorder gets very bad is when they start manifesting kind of psychotic symptoms. On the other hand, there are primary psychotic disorders, which I was talking to you a little bit about schizophrenia. There's also some precursors or things that potentially can turn into schizophrenia. One would be a brief psychotic episode. Another would be something we call schizophreniform. These are all different criteria based on how long they go on. There's also something called a delusional disorder. These are different types of psychotic illnesses that vary based on the number of symptoms as well as how long they go on for. In terms of the significance of differentiating those 2 major groups, either mood disorder with psychotic symptoms or primary psychotic illnesses, there's a big impact. And the impact is mood disorders are managed a little bit differently. They probably don't need to be on antipsychotic medications for an extended length of time. It may just be while they're in such a severe case. Their primary treatment will be a different group of medications. Whereas if we're talking a primary psychotic disorder, it probably has a little bit worse prognosis, and it also must be managed with an antipsychotic, often for lifetimes. Now, Joyce, I know you had a question about family members and how they come up. Can you tell me a little bit more about that?
What do you say to a family member who says to the person suffering from a mental illness, "Oh, you'd be fine if you just go to church more often, or if you just try a little harder"? How do you answer to that to the family member?
Joyce, that's an excellent question as well. And what I generally say is this is the same thing as every other major medical illness, such as cancer, high cholesterol, diabetes. This person did not want this illness. Now, it is probably similar in terms of how it came about, and we'll talk about that, but it is not something that if they went to church more often, worked a little bit harder, yes, they need some protective family members, and they need to have a better lifestyle, and it would put them under less stressful situations. But at the same time, they did not wish this on themselves or do anything or live a bad life that made them happen, and it won't be cured in that same